welcome, ma'am.
Thank you.
It's a pleasure to have you. Let me introduce you to the audience first. It's a pleasure to have Dr. Virender Sekhon with us. She's a director with the PURO clinic and a host of other hospitals. One of the leading pediatric urologists in the country. So, ma'am, we'll keep this very fluid, very open.
Sure, right? Thank you for having me, and thank you for the kind words.
Yeah. So, why did you choose pediatric urology, and what's been your journey since the beginning to the stage today, and where we are today in terms of?
Well, I'm glad you asked me that question. So, my entry into medicine was more by my father's choice initially. But then as time grew by, I kind of started liking it on my own as well. So the initial years of medicine were a lot of fun, a lot of academics mixed with extracurricular activities and all that story. I always knew that I wanted to do surgery, like a couple of years into MBBS, and I was very sure that I would take up surgery. But then pediatric surgery was again decided by my father because he loved kids. And I am myself like my father's true bacha. So that's how I ended up taking pediatric surgery after doing my MS in general surgery. Pediatric urology, as you asked, was more of a thing that even I wasn't aware of while I was doing even my specialization, because India never had pediatric urology fellowships by that time. So when I finished my super specialization in pediatric surgery, India was just waking up to the idea of pediatric urology. So I would say that I was one of the chosen ones to do pediatric urology rather than me choosing to do pediatric urology that way. So it's been a fun journey, I would say, and I've enjoyed every bit of it.
So most of the people don't understand this, but for example, so what's the difference between pediatric urology and a general urology as such? Is there a demarcation in that?
Well, I think the difference is as stark as between a child and an adult,
Okay.
Right? So children these days, would have a lot of emotional factors, social consequences. So of course that factor is there, but even the disease spectrum in children in terms of their urological diseases vis-a-vis the urological diseases that you see in adults is a completely different spectrum. So I would say that these two are very different specialities, and you do need a specialist pediatric urology whenever you have troubles with your children to take care of that.
So, we were talking to some other doctors as well. So, in your field, especially when you're talking about dealing with children, empathy factors should be very, very, high, right? So, what's your take on that in terms of when you deal with a kid or a mother?
No, so taking cue from the previous question again, Amit, like I said, children are very different right from the time that they enter into your chamber. You have to connect with them, make that first connect, because they may not always be very expressive in terms of mujhe yahan pain ho raha hai or this is where it hurts, right? So you actually have to connect with them, play along with them, because a lot of times as first parents, a lot of parents also do not recognize as to what the trouble exactly is. So it's important that you ask the right questions, elicit the right history, and the best way I guess you can do it is by empathizing with the child and asking the correct questions to them. So that's for sure a good head start to make.
And in terms of the Indian context, the Indian market, do people, when you started, you said that India was awakening. So have you transitioned as the transition come, or we're still getting used to the concept of pediatric urology as such, in terms of the generic people I'm asking, in terms of medical fraternity also I'm asking?
No, I would say that we are still sort of getting in that groove. Even the medical personnel, not very many are aware as to what a pediatric urologist is. So I believe it is my duty as one of the first pediatric urologists around to, share that or create that awareness as to what we exactly do and why we need that specialist branch. If you compare it with the West, like in US or UK, pediatric urology has been a separate branch for the last 2 or 3 decades. So in that sense, India is still, lagging behind. We are still transitioning. But I believe with a lot of social media and portals like this that Maatri is also taking up, it is a good portal to create awareness amongst the parents and public in general as to whenever your child has any trouble related to the urinary or the genital tract, you should always seek opinion from a specialist. whenever there's a need for that.
And the other day we were talking about, so I think being part of the education setup, in the sense of educating the schools more,
Yeah.
maybe parents at a very younger age, where I think pediatric as such as a branch, or gynecology as a branch. So is there a setup where all these three mix up or match somewhere, where, because somebody who's in the third trimester, let's suppose, are the mothers educated that बच्चे को ये problem हो सकता है, आपको conscious, मतलब where it comes to you as a specialist, ऐसा कुछ है अभी?
No, most of the time, Amit, what happens is, I mean, as a layman also, let's say, आपको और मुझे फीवर के बारे में इसलिए पता है because every second person has fever, and जब भी फैमिली में होता है you talk to 10 other people कि अच्छा मुझे फीवर आ गया, क्या करना है. So everybody knows कि फीवर होता है तो जी पैरासिटामोल लेना है, क्रोसिन लेना है, right? But as far as the troubles with the urinary tract or genitalia are concerned, which is my field, it is not a very open area to sort of talk about. So ऐसा नहीं है कि troubles होते नहीं हैं. A lot of kids would have those troubles, but you don't get to hear about them very often because we are not still very open to discussing these, even within our own families, right? So the awareness is still lacking in that sense. So let's say, like, coming to the specific question that you asked, that a mother in her third trimester, also we are not very proactive in terms of educating the people about preventive things कि आगे जाके ये हो सकता है. This is not that we commonly discuss, right? So it is only when it is picked up on your let's say antenatal ultrasounds, or it shows some trouble, is when that is your first exposure. That is when you get to know that, okay, there is some trouble. Now you need to see a specialist and they'll guide you further as to what can be done.
So let's talk about, so ma'am, one of the things which we were asking is that जो young बच्चे हैं हमारे 15, 16, 17, जो चाहे boys हैं या girls हैं, so do we have, so these kids are very smarter these days, right? They have a need of helping understand is one factor. Psychologist की हमें ज़रूरत पड़ती है जब हम मुझसे बात करते हैं किसी भी सिनेरियो में. Do you feel, or there is a need of a psychologist also to explain them a problem today?
No, I wouldn't say that we specifically need a psychologist in a lot of the diseases that we come across as a pediatric urologist, but I do firmly believe that I, as a pediatric urologist, have to get down to that level.
Okay.
I have to, speak the same language as them. So in some ways, I have to be their psychologist in some sense, and there is something that we call transitional urology. So as pediatric urologist, I look after kids who are up till, let's say, 15 years of age, and adult urologists look after kids who are 18 years and plus. So this time period in between, let's say from 15 to 18 years, is something which is not exclusive either to pediatrics or to adult urologists. So this is something that we call transitional urology. And this again we are trying to develop in terms of, how well you can hand over the child to your adult urology colleagues. So because there's a lot of overlap between the two fields.
Got it. I think I remember जब आपने अभी ये बात करी ना कि you have to go down to that level. I'm just quoting this out of context, but I was reading an article where people who follow cricket, is that where Ganguly was successful and Dhoni was successful because they used to go down to that player's level and talk the same language. So I think it makes complete sense.
True.
So what's the
just
vision?
that I don't go and play cricket with my kids, although I would love to do that someday.
So what's the vision behind PURO Clinic from?
We started PURO Clinic with the vision that, one, we become more reachable to people because, young parents with young kids, a lot of times they are scared of coming at bigger setups or bigger hospitals for a variety of reasons, unless and until that's the only solution left for them. So I think a smaller space like your own clinic makes you more accessible to a lot of these parents. It's a more comforting feeling out there. Also, we wanted to give them an option in terms of every person would have, different financial setup or financial constraints, so to say. So if at all it comes to a surgical intervention, I can always tell them that we offer the same treatment at these places, and they can choose for whatever reason, whichever place is more comfortable for them. So that way, PURO is like the center point of all the areas of work that we do.
Got it. So I think one of the things which I would like to know is that post your these are the surgical things, right? So I mean, these are, it's a more sensitive, more emotionally connected than because it's for children. Are you able to disconnect when you go back home post a stressful day as a doctor and as a person?
Yeah, before I answer that question, Amit, I'll just make a little correction there. So I am a surgeon. A lot of my work entails surgeries, but I always like to, say this, that as a pediatric urologist, we deal a lot with medicines also. So I always make this statement that whenever parents with their kids enter my chamber, they shouldn't come with the preconceived notion कि यहाँ से तो surgery होकर ही वापस जाएंगे. So we try and do what is best for the child. If it is only medicines, then that is it. It does not entail surgery. But if at all, my expertise of course lies in surgical interventions. So if at all it does come to surgeries, it's been a long time, long years. So most of the times we've been trained that way, is that you should be able to disconnect from work, as is true with any other field. I'm sure, right? That when you go back home, you have to be focused at your home affairs. But then a lot of times it may not be possible, right? So there are good days, there are not so good days at work, and that is true for like every place, not specific to surgery as such. But yeah, there are a few days when you carry that emotional quotient. If a child is not doing well, of course you are thinking what else can you do, what better can you do, so you do carry those questions home.
So as a person, as a doctor, I mean, how do you see the next 5 years in terms of where do you want to land up by 2000, let's suppose 28?
For 2028, next 5 years, just want to be a better person, a better doctor, a better surgeon than what I am today,
right.
And maybe a happier soul. That's the ultimate goal, and I guess that happens when you make your patients happy, the people around you happy. So that's the bottom line.
And how's been the journey with us, with Maatri for now? I know it's a long-term association because brands do take time, but we would like to know your inputs.
I think it's been a wonderful association. I quite like it that we are able to connect on a one-to-one, and it's always, approachable. It gives us a broader platform to reach out to more people, and I think our goals are aligned in terms of, like I said, making healthcare accessible and making people around us happier. So I guess Maatri and PURO both share the same goal in that sense.
So I think it's been wonderful to have you here.
Likewise, Amit, thank you.
We love your energy level, because we were talking to the team. I said, with ma'am, we don't need the mics here because we can talk so and freely here.
Yeah.
And one of the things is that we wish that PURO grows leaps and bounds in 24.
Thank you.
And as you rightly said, that accessible, healthcare should be accessible there. So I think we should work more at the providing the right education, and we look forward to partnering with you there so that स्कूलों तक पहुंच सके, घरों तक पहुंच सके और इसको लेके जा सके. Thank you for time.
Wonderful, Amit. Loved being here, and I hope we can continue the association and the energy going forward. Good luck.